We are covering leptospirosis today. It's also shortened to lepto often. We see a fair number of dogs come in with this condition, but pretty much any mammal is at risk of contracting it. Some mammals, including cats, are more resistant, and so we don't see that very commonly at all. But dogs can contract it from being out in nature. Typically, they get it from wildlife, and that is usually standing water, where animals in the wild do urinate if they're infected, and the dog unfortunately licks that water or it gets on their gums, mucous membranes, then they can contract it. The tricky thing about it is that the incubation period for how long it'll take for them to show signs is anywhere from a couple days up until about 20 days. So you may not initially think, hey, we were out on a hike, it was a couple weeks ago, and you don't really think about it. Clinical signs that you'll see in your dog include some pretty nonspecific things. They may be lethargic, they may not want to eat as well or be vomiting, and just in general seem like they're really not feeling well. Their muscles may ache. When they get into the hospital, one of the main things that will be noted is elevated kidney values, because this bacteria targets the kidneys and can cause permanent, terrible damage. That can be life-threatening. They can cause kidney failure very quickly. The other injury that it tends to cause, or at least often will cause, is liver damage, and that also can be permanent. So how do we treat it? A lot of the therapy is incorporating antibiotics, so it's a bacteria, we need to hit it hard and soon. The faster you treat it, the better for prognosis. And then also hydration. A lot of fluid support, making sure it protects the kidneys, keep the animal hydrated, and essentially diurese the kidneys, get them lots of fluids. The other really main factor is isolation. As I said, this is transmitted typically from urine, but any bodily secretions, and it can go to other mammals. That includes humans. It is zoonotic, and in humans it can also be very, very dangerous for a human to contract this disease. So we recommend wearing gloves, taking precautions around your pet's urine, and also keeping them separated possibly from other dogs. Very exciting, there is a vaccine for lepto. It lasts a year, and any dog that's out and about in nature a good bit, I would certainly recommend it, because as I said, it can cause these permanent changes. Even if it does not kill your pet, it's much better to just prevent it. Thanks, guys.